Talking Points.
We all are wounds.
The Wound Care Workbench.
Literature Library.
Featuring me, the lit, crit.
Hyperbaric Highlights.
Pearls and diamonds in the rough.
Hello, and welcome to The Wound Wire. You are probably thinking, wound what? I thought this program was called Wound Rounds Live. Yes, we have changed the name of the show. You are now watching The Wound Wire, the best edutainment program available on the Wound Information Network. Our new name is the subject of Talking Points. During medical school, and I find this hard to comprehend that we are now talking about over 30 years ago, I recall making rounds on a daily basis as a medical student. After graduation, I started my internship and residency training as a surgeon. I distinctly remember making wound rounds on our patients with open surgical wounds. Rounding on wound care patients is where I first began to develop a passion for wound care. When we decided to create this program, I thought back to my early days of making wound rounds and how that experience provided me with a strong foundation and the basis for my wound care education. The knowledge I gained and the enjoyment I experienced while making wound rounds 30 years ago is exactly the intent behind the launch of this show. Nearly every hospital and every wound care clinic in this great country of ours has a version of wound rounds, all with the intent of improving the care of patients with wounds. A simple Google search of wound rounds finds that this term is common and widely used. Over the past year, this program has developed into a unique global forum for wound care, and the content has expanded to include information on all aspects of wound care, case studies, new technology, literature, and research, as well as program operations, with the important information on billing, coding, and procedures. All of these are now included in the content of our program. We have taken you to the other side of the world with On the Road, and we have visited wound care clinics in Thailand as well as in the Philippines. We have provided you with interviews and insight from the experts and legends in the field. As we evolve beyond simple case presentations, we felt the need for a more expansive, a globally descriptive name for this show. We hope that you will continue to enjoy the novel show and the edutainment that accompanies our discussion of all aspects of wound care. But remember, we are now called Wound Wire. And that's a memo.